Well, I'll say a quick good afternoon from London and a very late evening from our colleagues in Indonesia. My name is Martin Short, and we're going to start the webinar very soon. I know we have a very full schedule and a lot of people interested in this. We're just waiting for some more people to join. Just for those people who can't see, we already have 200 participants on this webinar, but we are expecting some significant numbers more. So just bear with us for a couple of seconds more until we get all the people who have signed up connected with the webinar. Many thanks.
Bu Indri, Pak Firman itu mencoba untuk masuk pakai HP, tapi kok unregistered karena email di rumahnya tuh agak bermasalah. Jadi nggak bisa pakai komputer dan nggak bisa pakai itu.
Iya, dari tadi saya udah bantu dia juga dengan kirim juga beberapa new email.
New email, pakai new email, Dad. Oh. Oh, gitu.
Oke. Ya, mungkin Bu Nina aja yang masuk dulu ya.
Ayo, Dedi.
Okay, well, I think that we've, as we've got a pretty full schedule, I think even though we've got people coming on to the webinar in their droves, but let me start, and if people miss what I'm saying, I think that's absolutely fine. I think the panelists organized by NADA, I think, are far more important for people to see. So listen, welcome everybody to this roundtable on food fortification and the role of the private sector. My name is Martin Short. I'm the Chief Executive of the Power Nutrition, and I'm very pleased to co-host this with the new head director of nutrition at the Bill and Melinda Gates Foundation, Andreas Bluethner. So welcome to everybody on this. For those of you who don't know the Power of Nutrition, we are a charitable foundation based in the UK. We are and have been delivered out of the 2013 Nutrition for Growth Summit, and we focus on about 12 interventions, many of those supplementation. And one of the areas that we're particularly interested is in food fortification, putting the power of nutrition out of a job. And I think that should be the goal of everybody, is to make sure that they are not indispensable in this development space. And we think that, you know, we deliver supplementation through blister packs and drops through the health system, how much more efficient that should be done in the food system with the fortification of food. And Andreas will give us the benefit so that everybody understands what that really means in the writ large. The areas that we're particularly interested in terms of food fortification are the following. We know food fortification works. That isn't an issue that I think people have a great deal of an issue I'm thinking through. But what we do know is that there are still barriers, there are still binding constraints that are preventing us from doing a number of things. One is getting to the base of the pyramid. I think one of the things which I'm very keen on is to make sure that we don't just do food fortification or indeed supplementation for its sake, but also to ensure that we get to the people that are in the greatest need of that particular fortified food or those particular supplementation. Secondarily, let us learn from those things that work, whether it be salt, whether it be in the global north when, you know, bread and cereals are fortified back in the 1940s in the US, you know, 80 years ago on a mandatory basis. How do we learn from the learnings of that? And then we can roll those out into other areas of those countries that need. Where is the political support? Where is the advocacy? Where does development fit into this as opposed to private sector? Now, you know, private sector is absolutely, in my view, completely critical to the success of large-scale food fortification. It is all made in the private sector, and I think development have got to get out the way, in a sense, to make sure that we do the right thing and add value in the advocacy space especially, and the lobbying of governments, rather than actually think ourselves as being actually fundamental parts of that value chain in the delivery of these systems. Let us also remember, and you'll have heard this before from me, is that the private sector creates jobs, governments do not create jobs. Governments are responsible for the enabling environment, the land rights, the rule of law, and therefore, when this is writ large, the private sector is a key component part of this. I look forward to the discussion. I'm going to hand over to my colleague Andreas to take us through the next 3 minutes. Andreas.
Thanks, Martin, and thanks to the Power of Nutrition to co-host that interesting roundtable, very diverse. I'm very much looking forward to that. And welcome to all the participants online, also on behalf of the Bill and Melinda Gates Foundation. Large-scale food fortification, I'm into that subject for now 15 years, and we talk about 2 billion people being at risk of vitamin and mineral deficiencies, which means, for example, you have a lack of iron, a lack of vitamin A, and that impedes not only the physical and cognitive development, in particular of children, but lifelong, but also the normal function of the immune system. And in times of COVID, an impeded immune system is, I think, what we cannot afford, coming on top of poverty and, for example, climate change, increasing the risk to fall into malnutrition. And the good news is there is a market-based, scalable, and very cost-effective solution available, which means staple food fortification, for example, adding minerals and vitamins to flour, or vitamin A or D or E to oil. You can also put iodine and some iron and salt, or use rice or condiments as a carrier. And the beauty here is, as a principle, that these nutrients are added to staple foods, which are extremely affordable. They're eaten by the general population, including low-income populations at risk. And they're contributing like 30% of the recommended intake of these essential nutrients. So it's not a silver bullet. It's a base load. It's fulfilling essential needs, but it prevents people to fall into malnutrition, which has not only individual, let's say, negative consequences on health and productivity, but also for populations as a whole, and thereby countries, impedes educational, health, and economic opportunities. And it sounds very simple because it also doesn't need behavioral change. And this intervention is complementary to, for example, changing diets or improving intake of healthy foods like vegetables or fruits. But nevertheless, it requires a very strong interplay and engagement of public and private sector. And here we talk not about individual public-private partnerships, I mean small-scale projects. It's really a systemic interaction between public and private sector, where the private sector produces the food, adds these nutrients during production. So it's nothing we talk about here about breeding, that's biofortification. Large-scale fortification means adding in the process of milling these micronutrients, labeling them on the package, informing the consumers, and the government has to make sure that the market framework is set, that the consumers are informed, and they enjoy the right quality of these fortified foods. Because that's, I would say, one issue that is remaining. How can we ensure that these norms and standards that exist worldwide, where governments have regulated that iodized salt should be the norm, how can we make sure that there's a level playing field? How can we ensure that also the poorest of the poor, the price buyers, also get foods which are adequately fortified, and not someone is saving the pennies on the back of these poor and malnourished people? So that's an opening question, and I pass on the floor to Nada, our moderator. Thank you very much.
Thank you very much, Martin and Andreas, for your introduction. As mentioned, my name is Nada Al-Husseini. I am honored to be here today as the moderator for this interesting session. Just a little bit about myself. I've been working for 15 years almost in food fortification, mainly with a focus on public-private partnerships and strategic partnerships and fundraising for large-scale interventions. I'm based in Cairo, and prior to that was in Canada. We look forward to this dynamic discussion with our distinguished panelists who bring a wealth of experience to this roundtable. Prior to going into the introductions of each of our panelists, I would like to thank the audience for your interest and look forward to your thoughts and questions, in the question and answer period, which will take place after the panelist discussion. We will have to be mindful of time. We have 1 hour to cover all the subjects, and as we know, there's a lot to be covered. So without further ado, I will start to introduce our panelists with us. I will start with Mr. Yannick Oing, who is the Global Director, Nutrition Improvement at DSM. He has a wealth of experience in partnerships and fundraising, and has worked in the area of driving and development of food fortification and supplementation. Current role is to impact public health through the development of innovative and affordable nutrition interventions. We have Mr. Samuel Misyuka, Quality Assurance Manager at Mandela Mills. Welcome. In Uganda, a food technology expert with experience in wheat and maize milling and quality assurance and quality control. He is currently in charge of wheat and maize fortification program. And Ms. Jessica Nworgu, a quality control manager, flour mills in Nigeria. Ms. Jessica is an industrial chemist who has implemented systems, processes, and procedures that support quality improvement. She has successfully led flour mills Nigeria to acquire certifications, ISO certifications, as well as quality management system certifications and food safety certifications. Ms. Indriani Ganawan is the Chief Executive Director of Nutrindo Interpharma Sajetra. Ms. Indrian has worked in many departs of BSF, Indonesia, and was in charge of human nutrition department, where she worked in oil and vitamin A fortification, and had led successfully public-private partnerships with oil being fortified with vitamin A. Currently, she leads Nutrindo Interpharma to distribute human nutrition and pharma solutions ingredients throughout Indonesia. Our panelist, Professor Sukerman, who's the founder and director of the Indonesian Coalition for Food Fortification, was not able to attend due to some connectivity issues, but we are welcoming Ms. Ebunina Surinani, who is the acting director, and we look forward to your input and contributions to this session. We will break into the question and into the discussion right away, so that we can hear and benefit from all the wealth of experience from all our panelists. My first question would be going to Ms. Indriani, Ms. Ebunina. Could you let us know what your key insights would be about the Indonesian food fortification experience? And what in your view are the two to three main elements that had to happen for it to come about as a success story, as the vitamin A fortification, for example?
Very much for the question, and it's an honor actually for the Indonesian Qualification Fortification to be invited into this important webinar. To talk about the importance of food fortification to improve the nutritional status of the poor, especially. Our best experiences in implementing food fortification to be mandatory policy is the public-private partnership. So the government should work with private private industries. And there are several steps that we have gone through. Of course, we have to initiate the awareness why fortification is important. We will have to talk with a number of decision makers at the government side, but also we develop what we call the country investment plan, and of course the feasibility study that we did not only in Jakarta but and other 5 provinces, and then we collect the evidence through field trial. And of course, this is one of the most important steps that we have to go through. And then we got the result from the field that by adding vitamin A in our cooking oil, palm cooking oil with vitamin A, the status of vitamin A in the blood of the kids increases. And then what is important during the study, we found out that the vitamin A is stable during the distribution, stable during the frying. This is important. And then consumer accepted, and it's confirmed. And then willingness to buy at additional, very small cost, additional cost. And then for the Makassar study, biological impact confirmed, means of retinal serum rises. So this is really, promising. And then the next step is we did what we call it advocacy to put oil fortification at national policy. And the government has what we call it the Food and Nutrition Action Plan. We renew the Food and Nutrition Action Plan every 5 years, according to the period of the government. And it's one of the activities included there. And then, of course, we have to find champion of the industries and establish the regulation. Thank you.
Thank you very much for this comprehensive response. This would flow very well into my next question, which is to Ms. Indriani. We would like to know your experience and your views on the significance of the public-private corporation collaboration in food fortification, and what do you feel the role is, and how you feel we can raise more awareness about the significance of this role.
Yeah, thank you, Nada. Good evening to everybody here. My long years experience in the food fortification teach me the importance of, again, public-private partnership. And we need collaboration and commitment of each of the stakeholders, not only the industry, also the governments and the patients, also from the scientists, to always campaign and educate. Also the users and the industry. Indonesia is a developing country with a very big country, and the education and campaign cannot be only in the big cities, but also need to be in the other area, in the other islands. And campaign and education is not only for the first year, it has to be repeated and repeated again, because also the government official may change and the industry responsible people will change. So as such, quality controls are also important in this case. Food inspector understanding of the importance of this fortification. Also the industry need to understand if we can increase the GDP of a country with the education, with the immunity on the vitamin A. So the demand will be increasing, the economy will be better. In this situation where the COVID pandemic situation also hit our economic situation, I think the immunity is very important. So this can only be achieved with the vitamin A fortification, so that we can increase the immunity of people especially for the poor, to also fighting against COVID.
Excellent. Thank you very much for your response. This takes us to our next question, which is to Mr. Yanni. If you could let us know what your view is the role of the private sector in achieving impact. What is the value added of the private sector, and what are the key elements that make it a success? It would be very interesting to hear your view and from your experience, your extensive experience in the private sector.
Sure, thanks, Nada. Good morning, good afternoon, good evening, everyone. And well, as Andreas and Idriani just shared earlier, I mean, it's clear that large-scale food fortification is now even more critically needed than ever. So we often hear that fortification is expensive, but actually effective fortification is very affordable. If you look at the incremental average cost per person per year for fortifying wheat or maize flour, for instance, with iron and folic acid, it's only 12 cents of a dollar, 12 cents per person per year. And when you look at the benefits, it's a no-brainer, right? So what is expensive, though, is poor quality fortification. And I think this is exactly where the industry has a clear role to play. And it's actually rather a duty, even. So I think we need to continuously and relentlessly advocate for quality. And if you don't have quality fortification, you're harming the poorest and you're wasting money as well. So on one hand, governments have a job to do to monitor and enforce. The private sector, including fortificant manufacturers like DSM, we should also be held accountable here. We need to act as a partner rather than a supplier. And we need to do really our very best to remove all the potential pain points from the millers and food manufacturers so that they can fortify without complexity, and so that fortification becomes for them as well a no-brainer. So just to go back to your question, Nada, so how can private sector really help in reaching impact and scale? First, definitely by providing cost-effective and high-quality fortificants, as well as technical assistance to both millers and government agencies. So fortification becomes ineffective if it changes the taste or look of the food, or if you do not use the right nutrient forms at the right levels, or if the fortificants are not stable or not bioavailable, for instance. So we need to find a way to assist the millers throughout the value chain, from the earlier stages of formulating the blend of vitamins and minerals, all the way to ensuring that they will be in full compliance with local standards. So what do the millers want? They want to ensure that fortification does not disturb their production process too much, right? And certainly that it does not impact the taste and the visual appearance of food. So we need to ensure that we develop and supply a premix which is cost-effective, fully traceable, and with the right physical properties like flowability and particle size, for instance. We also need to ensure that premix is formulated with the right overages. If we don't do that, that will lead to some critical micronutrient losses during processing, which will eventually result into fortification levels being below the standards, right, when you go for tasting, and obviously to limited impact and compliance issues. And just to give you an idea of what we do at DSM. So at DSM, we often organize, together with NGOs, UN, and government partners, training for millers of all sizes, from the smallest to the largest, to really help them understand how to comply with national regulations and standards, help them to understand which formulation will work the best and for which staple food, for instance, and also to give notions of quality, stability, sensory, and efficacy. I think it's really critical to work together on this. We are also a technical partner for governments to really help them to improve their fortification expertise throughout the value chain, from the development of technical guidelines for staple food, like rice fortification, for instance, all the way to supporting the development of local QA/QC capabilities in country. And just to finish, I would like to spend a few minutes on rice fortification. As some of you may know, I mean, DSM has pioneered years ago what is now the most widely used technology to bring back nutrients into rice post-harvesting. And now, together with partners such as WFP, we are working to bring this intervention to scale, as it could really be a game changer for malnutrition. So beyond developing the technology itself to fortify rice, we actually looked at the whole value chain in order to facilitate the scale-up. For instance, if I take the formulation side, we developed a premix formulation which helps to increase the bioavailability of iron in fortified rice. We are also trying to constantly explore how to make monitoring and testing easier with new technologies and through partners like BioAnalytics, for instance, that could develop rapid and affordable testing kits. Together with BioAnalytics, we developed a testing protocol for iron in fortified rice, for instance. We also developed a quick analytical test of vitamin A in fortified rice, which can be performed at meal level also with UV light. So just to wrap up quickly. So for me, to go back to your question, Nada, fortification quality is essential. We have to keep in mind that when we fail to deliver high quality fortified staple food, not only we create issues for millers and government agencies, but we also seriously impact the lives of the most vulnerable, right? So millers and food suppliers focus on what they do best, delivering food to consumer. They shouldn't have to worry about having to deal with compliance issues. So millers are really the true fortification champions at the end. And we have to do more on our end to remove complexity from fortification. So with that, looking forward to the rest of the discussion.
Thank you very much, Yannick, for your response. And this actually falls very well with our next question with Mr. Samuel Misuka, who is responsible for quality assurance and quality control at Mills. Can you please tell us some of the challenges that you face, and not just some of the challenges, what do you see as, how can we overcome, or please give us examples of maybe a good example of how you have overcome a challenge within the QA/QC on the level of the mill.
Yes, thank you. Thank you, Nada.
Thank you.
Very good evening from Uganda. Let me start with a small background of food fortification here in Uganda. Mandatory food fortification in Uganda was passed into law back in 2012. Under the law, wheat and maize flour millers with installed capacity of 20 metric tons and below were exempted from mandatory fortification. These millers are majority here in Uganda. Under this law, vitamin A, B complex, zinc, iron, and folic acid were identified as most deficient in micronutrients among vulnerable populations in Uganda. Anemia, indicator of iron deficiency in Uganda, afflicts 1 out of 2 non-pregnant women. Vitamin A deficiency among school children in Uganda stands at 28%. Vitamin A supplementation covers 1/3 of children under 5 years. At Mandela Millers, we are committed to produce fortified wheat and maize flour to continue bridging this gap in micronutrient deficiency among vulnerable groups. This commitment has not come without challenges and the complexities. Some of the challenges we have faced on the ground in food fortification include: 1, there is low level of consumer awareness on the benefits of fortified food. Another challenge we have faced is influence on the color of final cooked or baked products by some compounds in the fortificants. This has resulted to negative perception on the fortified flour by consumers, mostly yellow color in this matter. Another challenge we have faced on the ground is caking and the lumping of fortificants in microfeeders. This has resulted to inconsistent flow and the underdose of vitamins and the minerals into the flour, both for maize and the wheat flour. Another challenge we have faced is feedback on the test results of fortified flour from accredited laboratories. The results take too long, and this affects decision to initiate corrective action or not to. Actually, the minimum period is 14 working days to get back your results for these vitamins. Another challenge we have faced is cost of importation. We import fortificants direct or through agents, and the cost involved is very high for most of the millers here in Uganda. Another challenge we have faced is the cost of testing vitamins and the minerals in Uganda, whereby, for example, to test vitamin A alone is 100 USD, which actually is not very, is expensive for most of the millers in Uganda. Then another challenge we have faced is persistent failure of vitamin A, zinc, or iron results from these laboratories. And the reason for this is mostly incorrect formulation of the fortificants. We have also faced another challenge of delivery turnaround time of fortificants from manufacturers. To import these fortificants from most of these manufacturers in Germany, South Africa, for example, India, the minimum time it takes for these fortificants to reach here is 90 days. Millers will run out of stock in between these 90 days. And the result will be milling and fortified flour. Then there is lack of enforcement policies by the government on national food fortification. Majority of millers here required by law to fortify don't fortify, and no penalties from the government. Then the last challenge we have also faced, we have lacked millers association here in Uganda, which can increase bargaining power in terms of access for trainings, access to resources, and advocacy on the food fortification. So most of it, yes, thank you.
Thank you so much for your outlining for us the key challenges that you're facing on the ground. And we really appreciate your informative discussion. And we will turn the discussion to Ms. Jessica to see way forward. What do you see as solution to some of the challenges that are faced, that you yourselves and millers in general face on the ground?
In this matter, we require to partner a lot with the research institutions and even universities to do a lot of research in terms of sorting some of these challenges which we are facing with the microvitamins and the minerals, yes.
Great, so collaborative efforts between the different sectorial, multi-sectorial collaborative efforts. Maybe Ms. Jessica, you will be able to tell us some examples or some that you've seen or you've actually been involved in addressing some of these challenges. We look forward to hearing from. Can you hear me? I don't think this is the audio is
Can you hear me? Can you?
Yes, now we can hear you.
Can you hear me?
Yes.
Okay. Thank you for having me in this webinar. It's interesting. In Nigeria, we have a lot of challenges, just like he has mentioned, but then we've been able to work around those challenges by making up our mind and deciding that it's the only way fortification can work, food fortification can work is through if it is private sector driven. When this was done by the TechnoServe, they came in and it was funded by Bill and Melinda Gates Foundation. TechnoServe came in and realized that there was a gap between regulation and then the industry. So the industry CEOs of flour millers came together, had a meeting and decided that they would have to champion it. And then thereafter, what we call the Micronutrient Fortification Index, MFI, was born. And MFI is just a self-assessment. You assess yourself, you know where you are, and then where you're going to. It's a cost-effective way of combating micronutrient malnutrition and improves lives. We also realize that with MFI, it supports existing regulatory systems. Since it is a private sector driven, It elevates the profile and awareness of fortification within the firms. We find out that even in the firms, no longer the regulations must come in and regulate us. But this time around, we regulate ourselves, we make sure things work out. We are no longer fortifying because it is a statutory requirement, but we fortify because we know that it is the right thing to do. It improves the alignment of internal quality system. It complements other standard of assessment, just as like ISO. And then in Fly Mills of Nigeria PLC, FMN PLC, where I am from, our mantra is feeding the nation. That is the mantra of the company. And so we happily participated in the pilot plan of the MFI, that is micronutrient fortification, the first initiative in 2019. And then what is the need for us? What is the gain? We realize that with that, we're able to contribute to the growth and development of children through fortification. It curbs stunted growth in children in Nigeria and in Africa. We're also happy because it will improve the life of Nigerian households, especially the poor. And through fortification, it will also lead to reduction in undernourishment. Consequently, we'll find out that it will improve the country's GDP and, of course, the strategic sustainability of business ventures. Will it, and then another question we'll have to ask ourselves is this going to work? Is it workable? Will it yield results? We were very optimistic in Nigeria that it was going to yield results because we know that once it's private sector driven, and then the CEOs of the industries, highest decision makers in industry, we are backing it and they were ready to do that. So we know it was going to work. And so we started that and it's been wonderful.
Thank you very much, Jessica, for this very insightful discussion on the role of the private sector. I think we may have, the voice may have cut there at the end. We will move to the next question, which is about the role of, the key steps we need to take to further multi-sectorial partnerships and private sector engagement, basically looking at way forward. And this would be addressed to the co-host. Perhaps Andreas, you can start, and then Martin, please.
Great, yeah, thanks. And thanks also for the very rich and diverse, I would say, comments. That's a true roundtable. I mean, putting challenges on the table, showing commitment from the private sector, because it isn't that black and white that you can just say, well, it's the right thing to do. It's always easy. I mean, food production in these harsh environments can be a challenge as such, and adding micronutrients in the right amount, the right quality on a continuous basis, I mean, is a technical exercise. And therefore, I would underscore first what Yannick also has said, and also Indriani, B2B technical assistance to me is a very key component. We are also looking in the foundation in our new strategy how we can help to accelerate companies helping other companies to get this thing right. And the producers of micronutrients, I think, are in a pole position to help millers on a more continuous basis. And also, I mean, analytical companies, BioAnalyt has been mentioned. I think we need, as soon as the pandemic allows, go more, let's say, in countries, in multi-stakeholder settings, provide trainings, factory visits. And I've visited so many factories. I think it's a very valuable exercise to do that. In times of COVID, I think we need to find ways beyond such a global roundtable to really provide targeted assistance in a remote way. And I think everybody here potentially in the head needs to shift gears a little bit from before pandemic and the new normal. What can we do with these partnerships between business and business? What can Yannick do? What can Indriani do? And other companies that are also online to help millers, which are key to provide these foods fortified, to help millers to do that right and to overcome some of these challenges. And the challenges Samuel has outlined, like a clumpiness of premix, I mean, that's things that can be overcome with the reformulation of premix, for example, but you need to create the right linkages here. coming back to what the private and the public sector need to do, I mean, I looked in the chat a little bit. There's a few questions pending. I think cost effectiveness is really key, and looking at the cost addition, it sounds marginal, like 0.2, 0.3% for vitamin A in edible oil, maybe 1% or 1.5% for flour, or even less. Still, that adds up. So I think really important is that private sector and public sector jointly agree on the commitment to mandatory and level playing field. So if you want to have a health impact, everybody in the country needs to join. I've seen a question, how about the small millers? Are they squeezed out? I think a good mandate, and we are also looking into how we can help countries to make meaningful regulation on fortification. Smaller mills can be excluded. I mean, sometimes there's a lack of technical capabilities to do that. Sometimes they want to do it voluntarily, but the bigger ones have the capacity. But it also means that imports need to comply. It cannot be that local millers, I mean, are committed to local populations and fortify, and then there comes imports that erode the level playing field, that come in under cost and on the expense of the health of people. And I mean, we are talking about a human right here. I mean, nutrition, including micronutrients, is a human right and an essential need. So non-fortifying is not trivial to me. I mean, and for a good reason. Some of these mandates include very harsh penalties. However, I think we need also more investment, and we need more investment from donors in public-private ventures like fortification. I think there's too much of a traditional view on all angles. So private sector too much still sees people like Yannick or Indri as, I mean, very useful but still exotic ventures. I think it needs to go to the heart of business to provide social impact and do good business at the same time, as well as it should be for governments. They shouldn't be shy to see public-private endeavors as, I think, an opportunity in times of COVID, where budgets are shrinking and where, I mean, a private sector providing a continuous flow of a health impact. You just need to frame that adequately and maybe invest in monitoring. That's a very cost-effective and large-scale impact a government can have if you open your mind to say, well, we are not only investing in traditional ways of achieving zero hunger, but we are also looking in these, let's say, a bit innovative, maybe sometimes you have to leave your comfort zone because you need to talk to unconventional partners like the private sector. You have never talked to the private sector maybe as a health official, or as the private sector you never talk to a health official in the government. I mean, that's I think an important lesson, but we need these investments, and we need also governments to step up. I mean, if it's about a few $10,000 per year to equip the officers in a meaningful way, also at customs, with the analytics and with a bit of training to monitor if these foods fulfill the requirements the government has set forward. I mean, a few $10,000 even for a developing country compared to the benefits that come with that intervention, I think is small. And I mean, in terms of compensating for COVID or doing other interventions, I mean, governments are able to step up. And here, I think the leverage is enormous. And leading health economists, including Nobel Prize winners, found out it's one of the best investments into human development. So I think what Indri also said in Indonesia, I mean, continuous advocacy, I think is important. And I think we hope, I hope we created some excitement and also some re-energized some of the champions in food fortification. I've seen in the chat, I mean, many very well-known names here to kind of step up. We are trying to do our part at the foundation with our partners, Power of Nutrition and others like GAIN here, to in the next years re-energize the community to really get ready for the question, who's going to feed 10 billion people living on that planet very soon. Thank you.
Thank you, Andreas. Martin, would you like to add to this discussion, please?
I'll be brief because I know now you're keen to get the audience involved here. So, I mean, I suppose that I have one question here. Are we going to reach a further 1 billion people by 2030 without multi-sectorial engagement? Because I think the answer to that is no. And secondly, then I'd say partnerships and collaboration are incredibly hard and very easy to talk about and very difficult to do, because it means compromise and it means equality. And we in development are not good at doing that. And I think that we've got to play a part in it. And thirdly, how do we incentivize governments? Because actually a lot of this comes from a top-down approach. Regulatory environments, legislation, who pays for it? Who's going to pay for the premix? Is it all the burden of the private sector? Is it all on the consumer? Is it all on the government, or is there a shared value here somewhere? And also we've got to persuade governments, you know, a lot of people in governments are unwilling to look at the global data to influence their local decisions, and they want to have local surveys done to persuade them that this is good. How do we think through that multi-sectoral approach to persuade governments that actually look at the global data, because that should be guiding the bigger picture? Nada, I'm going to stop there because I know that you're keen to ask other questions that are coming through the chat.
Thank you very much for this and for all the panelists for the discussion. And I think we have a very well-rounded idea about the key challenges and also the key steps that we can take to reach our goals. And with that, perhaps we can open the floor to the many questions that are coming in at the moment from the Q&A. We have several that have come in around coverage and reach. How can we make sure nutritious food reach the bottom of the pyramid? Can this please be answered by Samuel and Jessica, please?
Dada, come again, please.
How do we ensure that that we are reaching the bottom of the pyramid with the nutritious food? How do we know? How do we know we're reaching our target populations in these interventions?
We are targeted mostly the school children, that is the primary and the secondary schools, and we have allocated a specific amount of flour to be consumed by that vulnerable group. So at the end of the day, and cumulatively at the end of the month, we are evaluating at the numbers and looking, seeing are we realizing the targets which we have put in terms of targeting those vulnerable groups like the school children especially.
Thank you. Jessica, would you like to add to this? How do we measure, or how do we know that we are reaching the bottom of the pyramid? Are we reaching our targets?
Apart from the fact that we measure in the companies, just like I told you, we do self-assessment to measure to be sure we're sending out the right fortified food. We'll realize that we have consultants that measure to confirm that this fortification gets to the market as it is and is consumed. And then by early of 2000, I think about 2001 or so, when Nigeria started fortification, we had vitamin A as a 30,000 IU. By 2015, we reviewed the standard. We realized that because there were studies, and we realized that vitamin A deficiency was not so prevalent in. Now we do 6,000 IU for vitamin A and others. So we measure it, regulatory bodies measure it, we do research and find out as it goes. We'll find out which one is more prevalent, which one has not worked, which one do we need to increase. Then we review our standards again and we continue. Does that make sense?
Yes, of course. We thank you for this response. And we go to our next question. There are several questions that have come around the private sector engagement. In order for large-scale fortification to be effective, the government should issue national standards and regulations, but also create an enabling, less restrictive environment for private sector engagement. How can we strike that balance? Could please Yannick respond, as well as Nina, please?
I can try, yes.
Your general thoughts around this.
Sure. No, happy to try. No, I mean, well, clearly when you look at projects and fortification, right? I mean, one of the main bottleneck often is cost, as I mentioned earlier, and it shouldn't be seen as a cost, but rather as an investment, indeed, as Andreas mentioned earlier. And indeed, I mean, the role of the government is key here. There's the monitoring and enforcing, obviously, but also, I mean, governments, I believe, need to have some kind of incentivization to really push industry. And for instance, I mean, if the cost of fortification of premix is too high, can we look into ways to, for instance, remove import duties for premix to make it more affordable, for instance, whenever the premix is not produced locally? Can we look at what Andreas mentioned earlier, unlikely partnership? You know, is there a way, for instance, where we can get some seed funding initially from donors or NGO for the year 1, year 2 to subsidize, to donate, and then subsidize the premix just to trigger demand? And I think that's where we can really have an interesting collaboration, public, private, government, NGO, UN, to make sure that we can drive the cost down, create acceptability, and reach scale. Hope that answers your question, Nada.
Perfect. Thank you very much. Nina, do you have any additional thoughts on this?
Yeah, as our experiences, we did learn as how to work together with private sector. And as I thought at the beginning, PPP is very key to working not only with government, but also with private sector and the academics. And also, of course, some of the NGOs, and to put the efforts for food fortification in the government action plan, and that is it's very key. And from there, we can go on into convincing the industry, and then to of course, assist the industry at the beginning stage, and then support them with mandatory fortification policy. I think that is what we need to do. Aside from that, economic feasibility and the benefits for industry need to also be done. So you know, all stakeholders knows what they should do, and knows what they will get from implementing this mandatory fortification. And I think what should be underlined, food fortification is to address nutrition problems at the population stage, and we do want to increase the nutrition status of the whole population. And this during this COVID pandemic, I think it's timely to improve the immunity, especially for the poor, to the pandemic. Thank you, Nanda.
Thank you very much for your comprehensive response. One other question that has come in: how can we achieve sustainability with private-public partnerships? I think this we've covered quite a bit of it in our discussions, but perhaps we can add a little bit further. If you can kindly, Indri and Martin, discuss this. How can we achieve sustainability with private-public partnerships? Indri, would you have some thoughts on this?
You're muted.
And you're on mute. You're on mute.
Yeah. Sorry. Yeah, Nada. In this case, sustainability is very important. And how to achieve this is to have good understanding the importance of fortification. And number two, also as industry, we also need to have efficiency in the production to also reduce the cost, that it have to be cost effective and affordable for the people. As our goals is to reach the fortification also for the poor. Understanding of the consumer, so that people use this fortified food as good as it is, as it has to be. So understanding and also commitment and efficiency is very important.
Thank you very much.
Also, last point,
response.
also, sorry, good quality of the fortificant, so that sustainability and shelf life of the food, fortified food, is important.
Thank you very much for that. Martin, would you like to add some comments onto this?
Yeah, I mean, you know, sustainability, I mean, I think that's one of the words that that come across all the time, I think, in development, in terms of, you know, what happens when something leaves, what happens when you come in with a new intervention with grant money, or indeed the private sector doing a pilot scheme. What happens when it goes? You have no sustainability there, because ultimately you don't get any systemic reform, which drives into your sustainability argument. So I think it's really important to see, you know, which of the stakeholders has which responsibility in which parts of the sector and the value chain. So you know, what is the role of the private sector? And ultimately, you're going to get some sustainability when you get the right price points and the portion size, which are going to be driven by the private sector. You can't expect Yannick at DSM forever to come in and be fantastic with his shareholders' equity and give away his product. That may be an initial process by which you actually get some pilots going, or you may get some buy-in from the public. But ultimately, to find that sustainability, you've got to have that balance between the profitability of the private sector. And profitability is absolutely not a bad word here, because without the profitability, people like Yannick are not going to come and provide those premixes. Also, of course, at the end of the day, listen, we've got to get premix in country as well, because we can't keep importing this stuff, because there are taxes and all those things that I would like to see that Uganda and Nigeria and Tanzania and Ethiopia and Indonesia be able to actually have premixes which are actually made in country, because I think ultimately that will actually drive a lot of the sustainability.
Thank you so much, Martin. Unfortunately, we're running out of, unfortunately, we're not going to be able to take any more further questions, but we'll have to go to the closing remarks. If Andreas, you'd like to start with the closing remarks, please. Andreas and Martin, of course.
Andreas, you're on mute.
You're on mute.
Yeah, thanks. That was a very lively discussion. I really enjoyed. I think we heard there is, I mean, 15 years of progress. I would say the glass is more than half full. We have in around about 40 countries oil fortification. We have like 75 countries with flour fortification and nearly universal salt iodization. So beside of the challenges that remains, or call it a wish list of investments, I think that has been a tremendous success story. And still, I think the poorest of the poor are underserved still when it comes to compliance, when it comes to quality assurance. I just posted it in the chat. I think we need innovation also on analytics. I mean, coming back to Samuel, it cannot take 6 to 8 weeks before you get your flour analyzed and then you pay $100 for that. I mean, the food is eaten meanwhile. So I think we need smarter, quicker, and more cost-effective analytics, and also maybe more, I would say, data system approaches. And I mean, if you look at curative approaches like medicines, there's so heavy investment of all stakeholders. I mean, we talk about foods that have an enormous effect for health here. So I think we need to scale up investment and commitment, and we are on a good way with that. Thanks.
Thank you. And Martin, would you like to say a closing word on this?
Yeah, listen, I mean, I think it's been a really exciting discussion. I have been looking through it, as Andreas has, in terms of some of the questions, very, very good questions. I don't have answers for a lot of them. And I think that those are sort of the things that you're going to get to a lively discussion to move forward. I do think efficiency is a key to this. I think that if you're going to be able to provide, fortified food at the best and the most competitive price available, and as Yannick says, without altering the taste and without altering the visual content, you're going to have a winning scenario. But absolutely, I think this whilst it can be bottom up to a certain extent, and you can have advocacy to a large extent across the global north and south. Ultimately, I think the challenge is to persuade governments that with all the competing priorities that they have post-COVID or current COVID, this is only one factor on their ledger. They have got everything from education through to power and infrastructure, through to 3G, 4G, 5G. How do we elevate the discussion to make sure that those recipient governments really believe that it is the best value for money to make sure that their population is well served by the food system, which is a private enterprise. 99% of all food is made in the private sector, yet it is the most interfered with out of all sectors. And so how do we make it more efficient? How do we make it governments to really understand that this is the best value for money and that they put in their dollars there, they're going to get the best return over a decade? Nada, thank you.
Thank you to everybody and to our panelists for this really engaging and comprehensive discussion about food fortification. And many thanks to our audience who have asked really many very interesting questions. Unfortunately, we can get to them in this panel, but this all goes to show that there is definitely a large interest in seeing food fortification become more and more of an intervention that the governments can go to mitigate either effects of COVID-19 and other impacts that have happened in the economies. We look forward to hearing from you and your feedback for this forum. We will be getting back to you with the proceedings from our discussion. We'll be sending all the emails as well as responding to your questions by the respective panelists. Thank you once again.
Thank you.
Very well done, Nada. Thank you very much.
Thank you.
Thank you all participants. Really
Thank you, Nada. Thank you, Pa Andreas, and Pa Martin. Thank you. Thank you so much.
Bye.
It's already almost midnight.